Who wants to learn how to kill a tumor with ice? My name is Kristen and I'm an interventional oncology clinical specialist. I provide clinical knowledge to physicians as they perform cryoablation procedures in their practices. I will educate you on cryoablation and how it is used to kill tumors. You will learn how physicians plan their cases for each patient and can see some real-life pictures from cases. Cryoablation is a minimally invasive procedure that uses argon gas to freeze and destroy abnormal cells or diseased tissue. These patients are referred to interventional radiology by urologists, vascular surgery, and oncologists to give patients an alternative to surgery. Not all of these patients are put under general anesthesia. Some are given mild sedation through an IV, similar to what you may know as twilight sedation, which means you feel sleepy but you're still awake and responsive. This procedure can take anywhere from 1 to 4 hours, depending on how many needles are being placed. The freezing thaw time will only take about 35 minutes itself. We mainly see these kinds of procedures done in hospitals because of the readily available resources, and other physicians such as pain management specialists and breast radiographers have also branched into the cryoablation world, and I've listed a few of the common areas that we are seeing cryo done, and some are technically off-label. Procedure planning is crucial when deciding if cryoablation is right for this patient. These decisions are made by the device rep, such as myself, along with the physician. This chart shown helps the physician decide which cryoablation probe to use by measuring the size of the lesion and comparing it with the isotherm chart shown here to ensure proper ice ball coverage of the lesion. This chart shows 5 different kinds of cryoablation probes in 14 and 17 gauges to ensure the smallest incision sites and minimal bleeding. These procedures are done peripherally, which means the needles go directly through the surface of the skin without having to actually cut open the patient. These minimally invasive procedures are preferred for patients who may have underlying health concerns that may not be ideal during regular open procedures like surgery. There are several medical device companies that have a cryoablation machine. This is the Boston Scientific IceFX machine. It holds 8 cryoablation probes and uses argon gas to create an ice ball at the tip of the cryoablation needle. Argon gas reaches negative 140 degrees Celsius to ensure cell death in these lesions. Many hospitals own this machine and are able to perform procedures on their own without the assistance of the device rep. In this picture, you will see a CAT scan image of the kidney area. The image on the left with the asterisk shows the area of concern. Certain parts of the body are difficult to get to because of other organs in the way. Physicians have to look out for the best possible trajectory to aim the cryoablation needles into the lesion without harming any other healthy tissue or organs such as bowel and lungs. Physicians will use a technique called hydrodissection, using an open-ended needle to push other structures out of the way with saline not coming in to make sure that they are not coming in contact with the ice ball. Like all these procedures, each procedure comes with its own risks. Most outcomes that are not ideal can be helped with other interventions. This is a digital animation of what an actual tumor may look like, with cryoablation probe going through it. Once the gas is turned on, an ice ball is formed at the end of the needle. With the freezing thaw process, it destroys the cell membrane and continues to break down in the hours and days post-treatment, leaving behind a healthy, non-cancerous tissue such as a scar. These are a few of the pictures of what ice can look like during a cryoablation. Because the gas gets so cold, it creates frost on the handle and the cord of the probe. Doctors can use up to 8 probes with this machine to form various ice ball sizes, and shapes. Because no two tumors are shaped alike, doctors can use a variety of probes to ensure the lesion is completely consumed by the ice ball. Well, I hope you've learned a lot from my presentation today and can appreciate the advances in healthcare technology to ensure the best care for our patients. Have a great day.